with that, I would like to welcome Professor Graham Currie of Monash University, and Graham is the chair of public transport and also the professor of transport engineering in the Department of Civil Engineering of Monash University. Graham, the floor is yours.
Thank you, Jain. I'm here to talk about our research program looking at the long-term post-pandemic impacts of COVID-19 on commuting in Melbourne. This program, I'm leading the program. It's being managed by Taru, Jain, who's going to talk next about some of our modeling of work from home behaviours, and Laura Aston. The program is supported by the Victorian Department of Transport. The presentation outlines findings of the study, looking at the long-term post-pandemic impacts there. We're actually monitoring changes during all the various phases of lockdowns and non-lockdowns, but our particular interest is in the phase after the end of the pandemic, looking at to see if the pandemic itself has changed any travel behaviour. Our focus is Melbourne, Australia. It's a 5 million person city. It's a sprawling city. It's about twice the spatial scale of London. Our particular focus on this particular presentation is about commuting and the spatial divisions within a city. Our research tool, if you like, is much like the Rutgers study. We had a representative sample survey. This was very carefully designed to be representative of all age groups and income groups, but it was specifically designed to be able to look at the spatial scale within the city of changes that were going on individual travel behaviours at a high level of detail. The sample was very large, over 2,000, and our main tool for forecasting the future was asking people to look at their travel behaviours pre-COVID and during the pandemic, and then to look at their self-reported changes they thought the pandemic would have in their future. I'll go through the results now. This is looking at the total volume of commuting. On the left, the changes in commuting suggests that there will be a 6% citywide decline of commuting when the pandemic is over. Why is there a 6% decline? Well, if you look in the middle graphic, you'll see that this is the changes in work from home behaviour during the various phases of the pandemic. And post-pandemic, there'll be a 75% increase in working from home behaviours. How does a 75% increase translate into a 6% total travel decline? Well, that's because working from home has never been very big. In our last census, it was only about 4%. So that kind of matches up, really. We're saying a 6% decline. But what we also saw is a big shift in travel. And this is the prediction in mode shift when the pandemic is over. And on the left there, we see the mode share of the various modes throughout the city during pre-COVID and then post-COVID at the end there, and the shifts in travel behaviour. There's quite a little bit of a small change I've made in here, or we've made, as I've included work from home in the as well as the travel modes, so you can see the shifts. And work from home shifts from 2% to 5% citywide. But the biggest shifts in travel behaviour are from public transport to post-COVID car driving. What we're predicting here is that car driving is going to increase, and its main source is public transport. Overall, the car driving increases, not a good outcome sustainably, alpha congestion. But that's what we're predicting is that self-reporting, people think will be shifting. There's a few other shifts in there, but the biggest one is from transit to car driving. As I say, we were able to model this, or to look in great detail about different behaviours. I'm going to give you some headline findings of some of the key ones to do with the central area, the CBD, the downtown, and also what was happening within different parts of the city. This is on the left, the changes in work from home working behaviours during the various phases of COVID, and on the right is the changes for the citywide. And I've already talked about this, 75% growth in work from home after the pandemic. And what this shows on the left is for CBD jobs, there's a 223% growth. In other words, CBD downtown jobs are significantly changing more than the rest of the city. And what this translates to in terms of total commuting behavior is a very large 20% decline in commuting to Melbourne CBD, Central Business District. That is 1 in 5 jobs in the CBD after the pandemic will no longer be there. Also, we were able to track changes in travel. This is the net changes in travel for each of the modes. Melbourne CBD on the left and total Melbourne on the right. And as you see, public transport in particular down by 30%. Compared to Melbourne as a whole, 20%. Decreases in walking, interestingly. Car driver behavior is very much up, very difficult and for congestion. And biking is up, but it's a very small share. We were also able to track mode shifts for post-pandemic for each of the inner, middle and outer of Melbourne. For inner Melbourne, transit dominates, and it still dominates after the pandemic. But as you see, a much greater shift of from pre-COVID, from public transport to car driving is one of the largest ones, but public transport also to walking. For inner area residents, they can actually have that choice, and to other modes such as biking. Whereas in the rest of the city, not quite as large. So, what we're saying from this research is we do think it's a representative sample, quite a robust sample, that we will see a very big change in travel behavior. About the biggest change probably is the shift from transit to car driving. Certainly not a good outcome for congestion management or sustainability. This is the research team. If you want to know more about the research we're doing, we have a website, ptjg.info. And we also have a podcasting series, Researching Transit, which has an episode on some of our results. And that is it from me, and I think I'm on time.
Wonderful. Thank you so much, Graham. And all leading by great examples here. And I'm monitoring the chat, and also the colleagues who have questions could also post on the Facebook page as well for the longer discussion. So immediate questions on the chat, please. And while the colleagues are looking at this, perhaps I could ask a quick question, Graham. And in terms of the travel, car travel definitely will actually be up for a little while, as you say. But do you see that the peak time car travel is going to increase or reduce?
It's going to change according to where you are in the city. What we're finding here is CBDs and the inner area residents are very different to the rest of the city. And the outcome will vary according to location. Generally, the answer is yes.
Right. Well, maybe, because as you say that Dr. Taru Jain is going to present next, maybe you could actually consider some of these questions further after Taru has presented as well. And I'm delighted to introduce Dr. Taru Jain, who is a transport planner, an analyst, a visualizer, and a data storyteller. And of all these titles, I'm particularly interested in the last one. So I look forward to your presentation, Taru.
Thank you. I'll just share.
Yeah.
Okay. Good morning, everybody. Well, it is past 1 a.m. in the morning in Melbourne here. So hello.
Great commitment, and thank you so much.
Right. So it's a pleasure for me to be here today. I am presenting the second part of our project today. The introduction of our study was really given by Graham. So I won't really go back into the details. My presentation is mainly talking about work from home, and I'm specifically looking at understanding the attitudinal or the psychosocial determinants of working from home. So just to go back to Graham's presentation, the data I'm using is from the quantitative survey we conducted in June to August last year. It's based on the 2,200 online surveys. And of those 2,200 online surveys, we had about 1,400 people who were employed or who expected to be employed in post-COVID period. And of those 1,400, 527 people were specifically working in Melbourne CBD. And when we asked these people about how they expected their work from home behavior to change in the future, we found a startling startling finding that we could expect to see a 75% increase in work from home in the future all across Melbourne. And specifically when we look at Melbourne CBD workers, there was going to be 123% increase, so more than doubling of work from home. Now, it's also important to consider that the work from home number or the percentage is very small to begin with, but these changes are quite exceptionally huge. And also reflecting back on Rob's comments from the first keynote presentation, this data was collected between June and August last year. So this is based on perceptions from the beginning of the pandemic. What happened in the later months as we had that extended period of disruption and organizations started changing the messaging around work from home, we don't know. And for that, we have a second wave of the study coming up soon. So this is just wave one. So my idea for this presentation is I want to understand why are people changing, or why are people expecting a change in work from home behavior? Because we have this messaging around different parts of the world where some people say that, no, we need people to come back to the cities to work so that the economy, the coffee shops, the restaurants, the retail in the cities can be revived. But on the other hand, there is that argument that work from home is better to reduce the demand for travel, because that has impacts on the environment and on people's personal well-being and so on. So this is a big part of the argument, but I am only going to talk about what are the attitudinal determinants of work from home, of increasing work from home in the future. So we use theory of planned behavior as a lens to understand this. And it's a theoretical lens which really considers what are people's attitudes, subjective norms, and perceived behavioral control towards a said behavior. And the behavior in this case being increasing work from home post-pandemic. So attitudes are mainly their personal evaluation of the advantages and disadvantages. Subjective norms relate to what their friends and family expect and support. And given that work from home increases your time at home, this is very important. What employers are supporting and what the government is sort of messaging, how far somebody is willing to comply. So that is part of subjective norms. And then lastly, perceived behavioral control is all about the ease or the difficulty in engaging in that behavior. And it's all about perception. It's about what people feel they can or cannot do. So this is the hypothetical framework. And we had 11 attitudinal statements, 5 subjective norm statements, and 5 perceived behavioral statements. So these were Likert style questions which were asked in the survey, and people answered these questions on a 7-point Likert scale, ranging from strongly disagree to strongly agree. And then the data was put together. So these are all the variables. The dependent variable here is intention, which is the intention to increase work from home in the future post-COVID. Attitudes were all these factors relating to productivity, saving time, work-life balance, health, stress, and so on. And these were gathered from a deep dive of the literature and also the qualitative study that we conducted towards the beginning of our project. Subjective norms related to what friends and family and people important to the respondent thought, and also very importantly, what the employer was thinking about it. So were they supportive, and what the colleagues of the person, of the respondent were doing, or were they working from home as well? And then perceived behavioral control questions were around whether or not the job can be done from home, how easy it is, whether the person is comfortable using technology, whether they have access to the materials which are required to work from home, and lastly around interaction with their colleagues, whether it's easy or difficult, or whether they find it easy or difficult. So these were all the scores, the mean scores. So we see that environment was the most important factor in attitudes. Support from others was the most important factor in subjective norms, and comfort with technology was the most important factor in, or the factor with which people agreed the most in case of perceived behavioral control. But we can't say that these were the most important factors, because for that we have to run a regression model or some sort of a model which can tell us which one of these is having the biggest impact on their decision to increase work from home. And for doing that, we first did a correlation matrix to sift out factors which were the strongest factors having the strongest impact on the intention to work from home in the future. So we sifted out all the factors which had a significant relationship with the dependent variable. And then we used that data to build a structural equation model. So just deep diving into this model here, we found that for all the people across Melbourne, about 1,400 people, first of all, subjective norms and perceived behavioral control had the biggest impact. They had a significant impact. Attitudes did not have a direct impact, which really means that what other people are doing and how much people are supported by others is very important, and how easy or difficult the behavior is, whether it's actually possible for them, that's very important. People's personal assessment of how good it is for their work-life balance or whether it's saving them time is less important, because attitude, even though it did not have a directly significant impact on intention, it did have an indirect significant impact through the other variables. So work-life balance, looking at subjective norms, what people expected what people important to the respondent expected from them, how much support they received from them, and then what the other colleagues were doing and how much support employer was giving were all very important in that order. And looking at perceived behavioral control, the type of job was very important. It was the most important factor there, followed by ease, comfort with technology, and then access to materials. And when we compare the subset of people who were actually CBD workers, I won't go into too much detail because of paucity of time, but the main headline finding was that for the CBD workers, perceived behavioral control was more important and subjective norms were less important. We think that this is because already there is a norm within CBD workers who tend to be more white-collar workers to work at home. So because that norm is already there, that is not really it's such an important factor as compared to the Melbourne-wide sample. So going back,
Taru, if you could speed up a little.
Yep, just the last slide now. So
okay,
I would like to wrap up by saying that we really need to think about whether we want to encourage work from home or really bring people back in the office. And if we want to encourage work from home, then it's important to normalize work from home by messaging from the top, make it easy for the people, consider providing, subsidizing work from home infrastructure at home, and finally investing in technology and training employees. So that's all I have to say. Thank you so much. I look forward to seeing your questions on Facebook.
Thank you so much, and Taru. And a lot of thought-provoking ideas there. And as we have run out of time for discussion,
sure.
Now, what I'd like to do is perhaps to encourage colleagues to discuss with you on the Facebook page or by email afterwards, if that's okay. And so thank you so much, Taru. And I'm pleased to introduce next of Anna Reiffer, who is a researcher at the Institute of Transport Studies in the Karlsruhe Institute of Technology, and looking at the new forms of work on travel demand. So again, a very well connected topic. Anna.
Yes, thank you. Thank you. Thank you so much for the introduction. I think this fits in nicely with the previous speakers. I would like to talk about a project we started at the end of last year. So we've not seen that much progress, but I would like to really present the concepts of the project, which deals with the effects of new forms of work on travel demand. And although the grant proposal was written way before we even thought about a pandemic and the effect it would have on us and our working conditions, we now obviously see that there are long-term effects of the COVID-19 pandemic on working behavior. And just as a quick glimpse into the effects on working conditions in the EU, here's just a heat map of how many people have started working from home as a direct result from the pandemic. So we can see that up to 60% of the 63,000 responses or respondents have stated that they started working from home. And as the previous speakers also said, this is going to be, there are going to be some long-term effects on travel behavior and working due to the changes in working conditions. And we would like to include these changes in behavior into our travel demand model to analyze the effects that this will have on traffic. But as the previous talkers, and especially Dr. Taru, rightly said, that there are some constraints to when it comes to telecommuting. And as a first step, we analyzed the potential of telecommuting or remote work by looking at the constraints first. And these are basically that not every job allows you to work from home. I'm pretty sure tradespeople will always come to your place to fix to provide their service and won't change to work remotely. And then again, some employees don't want to work remotely because maybe they like to have the social interaction during their workday, or they want to separate their home and work life. And then also some employers don't want their employees who work remotely. And these are all the constraints we have to figure out first and who's affected by them. And then we look at everyone else and try to figure out how they're changing their behavior. So we've planned, or we're planning a survey to record changes in travel behavior, which includes a trip diary with a bit of a time use component. So we want to go beyond just recording activities and also see what people are doing during the activity. So if someone's staying at home and working there, we would like to see what this activity pattern includes. If they still work from 9 to 5, or they work different during different times of the day, and so forth. This survey we will conduct during the period of a week, because our travel demand model actually covers a week. And I think especially if we're looking at working from home, it's important to not just look at individual days, but longer periods, because some people may choose to only work a couple of weeks from home and then a couple of days in the office, and this will reflect both in the survey and in the model. We will use a smartphone or GPS-based survey because the response burden is really high. People have to record their trip diary for up to or for the week, and with the added time use component, the response burden is quite high. So we opted for the GPS-based survey. And we will also supplement the survey with an online survey and try to analyze effects of hypothetical new forms of work that go beyond working from home, such as co-working spaces or people starting to work in cafes in their own neighborhood. And yeah, as stated before, discovering their own neighborhoods as possible remote work places, so to say. So this will be integrated into our agent-based travel demand model, which is called Mobitop, and is developed at the Institute for Transport Studies. Just a quick overview, it's divided into the long-term and the short-term modules. So we have the population synthesis and the generation of activity programs in the long-term module, which are then simulated in the short-term module. And the key position where we will integrate new forms of work is basically the activity schedule, which you can see here on the right is created for up to for the week. And we have the general or traditional activity purposes, and our plan is to supplement these activity programs to account for additional activities at home, such that we don't only account for home-based, for people being at home and people being at work, but also for leisure activities at home and work activities at home. So we can get the activity patterns that we got from the survey into the travel demand model. And last but not least, we will integrate additional work scenarios to see the effects that they have on traffic, such as co-working spaces on the outskirts of town for people who may not want to work at home, but are okay with not traveling to their actual employer and would be all right with working remotely in some other space and stuff like that. So yeah, that was a really quick rundown of the project. I've listed the project partners at the top. As I said, this is still in the early phase of the project, but these are our plans. And thank you for listening. And I think I'm on time. And if you have any questions.
Yes, absolutely. Yeah, that's great. So thank you so much, Anna. And I would encourage colleagues to actually come forward with questions. Either now or actually discuss with you afterwards. And if I could ask a rather trivial question. So on your survey, there are countries like Britain and Norway, which are completely blank. Why is that?
That has to do with the fact that they are not in the EU. So I think
sadly, so the Brexit has taken effect, right?
Yes, apparently. So we didn't conduct the survey, but I'm guessing that is the trivial answer to the question. It was conducted by the European Foundation for the Improvement of Living and Working Conditions. So I just had to read that from my notes, but I think that's the easy answer. Yep. Now,
is the result presented in terms of regions or in terms of countries? I presume these are countries, right?
Yes, countries.
Yeah, so Benelux seem to have a rather dark color, which I interpret, maybe correctly or wrongly, you can say, that is where the responses are quite steep.
Yes.
And but Germany is a lot lighter. For that, I'm wondering, because you probably have a feel of which part of Germany may have responded rather like Benelux, and whether there are regional differences.
Yeah, that's a great question. So I haven't looked that deeply into the survey, and I think those are preliminary results. So I'll have to look if we can actually differentiate between regions. So just as a quick info, our model will be account for the region of Stuttgart, which is in the southwest of Germany. Yeah. But I think you're definitely right. There are we have to account for different regions, even if Germany isn't that big of a country compared to the US, but there are going to be regional differences.
Yeah. And is the survey also continuing?
I think so, yeah. I think they are continuing. They had a wave in April last year and then in June and July, and I'm pretty sure they're continuing. I can share the link to their, I think they have like a data dashboard. Yeah.
That'd be wonderful.
Yeah.
So, and if you could share that, then perhaps that would trigger more questions as well.
Not a problem.
Right. So, yeah, thank you so much, Anna. And,
thank you.
And so, a great presentation. Now, the next one is by Professor Jago Dodson and Dr. Tiebei Li. And this is from Australia, from RMIT University, I think it's the Royal Melbourne Institute of Technology. Well, this is now quite late, really late now in Australia. So rather thoughtfully, Professor Dodson and colleagues have done this video, which I think Rolf, you'll be able to show. So, and perhaps we could watch this video, which will be good. And also I encourage colleagues to connect with Professor Dodson and colleagues via email afterwards. Rolf.
Thank you. And let's see that I can start here.
Well, good afternoon, everyone. My name is Jago Dodson. I'm the Director of the Centre for Urban Research at RMIT University. And along with my good colleague, Tiebei Li, we're really delighted to be participating in this WCTRS SIF webinar on the impact of COVID-19 on transport and spatial development. Given the schedule of the session we're in, that would have put us at 2 o'clock in the morning in Melbourne. So I hope you don't mind that we've pre-recorded this presentation rather than stay up well past our normal bedtimes. Look, our presentation is on the commuting patterns in Melbourne and assessing the short run and longer term impacts of COVID. This work comes about out of a reasonably long running program we've had looking at questions of employment growth, accessibility and the commuting burden for employment centres and residential areas and for workers in Melbourne. This work has been going for a little while now, and most recently we reported some of our analysis in the Journal of Transport Geography last year. What this work shows is that Melbourne as a city has a weakly polycentric urban structure with a quite strong CBD. There's very highly differentiated sectoral commuting patterns in terms of which industry sectors people work in: manufacturing, construction, education, health, and so on. There's quite divergent spatial modal patterns in Melbourne. We tend to see a high rate of public transport use for CBD orientated trips and much higher, in contrast, very high levels of car-based trips for suburban commuting. But however, there's some quite complex spatial, sectoral and modal interactions, particularly once you delve down into the different occupational categories that workers are situated in. For example, managers have quite different commuting patterns to clerical workers or blue-collar workers. So just to give you a bit of a sense of the pre-COVID commuting patterns, this is Melbourne's spatial geography, showing the residential areas in brown, the metropolitan area in grey, as well as key employment centres within the city. Obviously, from this image depicting major flows of journeys to work, the CBD is overwhelmingly the dominant centre within the city. However, there are a number of suburban centres, such as in places in the southeast like Dandenong or Frankston, or Werribee or Sunshine to the west. But overwhelmingly, commuting in Melbourne is CBD orientated. So what happened in Melbourne during the first year of COVID? Well, we had a small lockdown from March till the end of April. And then in July, we saw a growth in COVID cases. And on the 7th of July last year, the Victorian government, which is the state government, where Melbourne's in the state of Victoria, the state government initiated another lockdown, which severely restricted people's movement. One was only allowed to travel for medical care, essential shopping, essential work travel if one was in a special category of essential worker, and one was allowed out for 1 hour a day for exercise. And that lockdown ran for 112 days up until the 28th of October. It was a very significant reduction in commuting travel. In the area that I live, the traffic on the roads was almost zero during much of the day. So this had a significant impact on commuting levels. If we look at the estimated commuting patterns during COVID-19, this is what we get, and this is based on stripping out all work trips other than health, transport, utilities, food and energy services. We can see that that's perhaps not entirely covering all the travel that was still going on, but as you can see from this chart, a considerable difference compared to the pre-COVID work travel. So the city was very much locked down for that COVID period. If we turn to the longer term impact of COVID, the discussions that have been going on amongst academia and in the policy sphere around which groups have been affected by changes in commuting. Office-based workers obviously are one of the major categories, given the capacity of people who do office-based work to work from home using computers for remote working. But also workers in retail and hospitality services. The retail sector has taken a significant reduction in activity under COVID, and hospitality as well has been particularly affected, both during lockdown but also afterwards, given the restrictions on expenditure that people have experienced through unemployment and so forth. But also this is spatially differentiated because much of the office-based employment in Melbourne is CBD orientated, so CBD retail and hospitality services have been affected by the kind of second round effects of office-based work being considerably reduced. And also we've seen effects on workers commuting by public transport. There's been perceptions, though I'm not sure they're necessarily accurate, that public transport is a potential site of transmission of COVID. Consequently, we've seen, to the extent commuting has returned after the lockdown, an uptake of car travel and a reduction in public transport travel compared to the pre-COVID period, notwithstanding the restrictions. So if we model this based on that 2016 data, we can see the kind of trip patterns that are likely to be affected by COVID-19 and the aftermath. So for example, in the top right-hand corner of this slide, we can see the journey to work patterns for retail and hospitality workers. Now those are quite strongly CBD orientated, but there's also quite a large number of suburban nodes around some of the major shopping malls, retail centres in the suburbs. So considerable reduction in those journey to work patterns. If we look at journeys to work using public transport, which is down the bottom left-hand corner, most of those trips are CBD orientated. Some of them are quite long distance, including commuting from ex-urban localities, particularly to the west and the southeast of Melbourne. There's very little public transport travel by comparison to those suburban nodes. So CBD travel is especially affected by reductions in people using public transport and vice versa. And then if we look at the bottom right-hand corner, the journey to work patterns for office-based workers. Now these are quite polycentric. There's quite a lot of travel to suburban locations in addition to the very dominant CBD. But just the scale of those work trips means that there's likely to be considerable reduction in travel based from office work. If we look at commuting patterns after lockdown, and this is based on the assumption that 75% of office workers will have returned to commuting to the office every day, we see still some quite significant reductions in those patterns. The polycentricity is in general still a feature, but the scale of commuting is considerably lower. And if we look at the bottom right-hand corner, this displays the extent of trips that have been reduced as a consequence of changes in travel behaviour due to COVID. So again, quite significant reductions in the patterns of travel by office workers. We can put some numbers to the overall changes in commuting levels before and after COVID based on the assumptions we put into our model. Before COVID, there were around 1.8 million work journeys each day. We estimate that that would be now down around just less than 1.6 million, a reduction of about almost 250,000. VKTs as well are considerably reduced, down by almost 3.5 million kilometres per day. We can also look at some of the estimates of impacts on traffic volumes. In particular, the freeway network is likely to be considerably reduced, especially by the reduction in office-based travel. The higher income one is in an office-based job, the more likely one is to commute by car. And those affluent areas of Melbourne, which tend to be in the southeast of the city, tend to display higher proportions of office-based travel by car compared to public transport. So you can see the southeastern parts of the road network are affected by reductions in car-based commuting. There's also another factor for a city like Melbourne, which has been a very high immigration city over many years, and that is the closure of the Australian borders have limited international migration to Melbourne. International migrations tend to settle in the inner areas of the city, particularly around the CBD, and consequently the reduction in immigration is likely to have an effect on the work travel of migrants in and around the central city area. So some quick conclusions. Obviously, COVID restrictions have had a major impact on commuting numbers and VKTs. The impacts, as we've shown, are likely to be highly differentiated spatially, sectorally, and by travel mode. Sectorally, we mean employment sectors. There's going to be continuing effects felt from immigration restrictions, but I think this is perhaps the case for most work investigating COVID effects. We need more work done to better record and model COVID effects on commuting. Look, I'll leave it there because I've gone on too long already. But if you've got any questions or comments, please email us via those addresses below. We'd be very happy to engage in further discussion around this topic and the question of Melbourne's experience in a wider international context. So thank you.
Oh, thank you so much, Jago, I wanted to say, and Tiebei. And